Good morning, good afternoon, good evening from anywhere around the world where you're watching us from. We're excited to have you join us once again on the ACE podcast. You are very welcome. So today we have a very important conversation for discussion. But before I let the cat out of the bag, we have several episodes we have recorded and put out there for you to watch. We've talked about maternal mortality, we've talked about entertainment, we've talked about other immunization topics and the like. So please go back, refresh your minds, watch, listen, share to your friends, family, colleagues, and of course, drop comments. We'd like to keep the conversation rolling. Okay, so if you're back, meaning you've watched it, right? You're welcome to this next episode of the ACE podcast. And today, we're talking about data. Almighty data. But before we get into it, so I'll just start by introducing these very important personalities to my left and to my right. To my right, rather, I have Afiz Olajire, the CEO and managing partner of ACE Group. Hi, Afiz. We are so excited and honored to have you join us today.
Thanks, Biobele. It's a pleasure to be part of such important conversation.
Happy to have you on my panel, or I don't know. And of course, to my left, I have Dr. Victory Equin. Dr. Victory is a manager here at ACE. We're so excited to have you join us.
Thank you so much. I'm excited to be here.
And of course, I'll introduce myself. My name is Biobele West, and I will be your host for today. And I welcome myself. Thank you. Excited to be here. But we're going to get right into the conversation. Data, like I had mentioned, data and the role it plays, especially in the maternal and newborn health space. That's what we're about to talk about. Previously, we've established the current state of things in Nigeria when it comes to maternal and neonatal mortality. Like I referenced, you can go back to get more information about what we discussed. But today we're going to look at the role data plays and how important that is for the work we do in our country currently. So, Dr. Victory, I'd like to start with you.
Oh, okay.
Why is data so central to the work that we do?
Thank you very much for that question, Biobele. This is something that I think the world all over, we've been trying to reiterate again and again and again, the importance of data, not just in the maternal and newborn health space, right, but generally in the health sector and in every other sector. Why is data important? I would look at it from two angles. There is first the importance of collecting data. And then there is second, the importance of using data to make decisions, right? Collecting data is very important to track progress. With where we are in the world today, nobody believes, you hear a lot of things like, research has shown, data has shown, the evidence that nobody believes that you are doing anything or you are not doing anything, or nobody really believes anything just by, if I would use the word vibes and inshallah. Data needs to back what you are saying. So first of all, for tracking progress, for saying this is where we are at and this is where we want to be, and then maybe in the middle of that, we say this at the moment, this is how far we've come. Right. So there's tracking progress, but there's also tracking performance. So tracking progress, as I mentioned, is most likely outcome data or like the impact data. Then there's tracking performance, which we typically look at as indicators. We have been in the health sector, in the maternal health space, a lot has been going on. There are a lot of partners, a lot of donors, a lot of people within the space. But to be able to say, this is what this person is doing and that they're doing it well, it's important for that to be backed by data, such that we don't just hear, let's say the Victory Foundation has reached 300 lives, and that is just some arbitrary number, but actually being able to collect the information, analyze it, and say this is who we have reached, and those people can be touched, right? So as I've talked about the importance of data for tracking the outcomes or the impact, the importance of data for tracking performance. Then there is the importance of data for decision making. So just collecting data is never enough. I think we're going to be talking about that some more if you give me the opportunity. But just tracking or collecting the data is not enough. Data is important to use to make decisions. For anybody that's a data analyst or a data scientist, you would be aware of the importance of data to forecast, to say that this is what has been happening, and we can predict that in the next 10 years, this is what's going to happen. Or in the next 15 years, this one's going to happen. And a lot of the times you see that you get as close to that as possible. So data is very important to forecast what is going to happen in the future, or to predict what is going to happen in the future, as well as to make sure that what is supposed to be happening now for that prediction to happen is ongoing. So yeah, that's the importance of data. It's very important.
Thank you, Dr. Victory. I hear a couple of things you've mentioned, right? Around collecting data and actually using that data to inform decision making. And Dr. Victory has done a good job of establishing the importance of data, right? I mean, when we've talked a lot about women, we've talked a lot about children, because, I mean, this conversation is centered around MNCH. But it cuts across the health system generally. Yeah. We've talked about that, and there are several interventions that are being ruled out. Funds are being ruled out. Money is being spent. How do we know what we even want to achieve in the first place, and if we are getting there? That's exactly what Dr. Victor has told us. Data helps to answer that question. So now that that is established, the importance of data is established, Afiz, I would like to ask, right, what are some of the systemic challenges that we're currently facing in Nigeria? Because one thing is obvious to all: data is still a problem for us.
This is quite timely. The problem we're having with data in Nigeria, I think I'll break it down into the ones that are human-centered, the ones that are system, and the one that has to do with tools, right? The biggest problem I think we have with data will be something around centralization. I think when programs are being planned, data is being treated as an add-on and not as a core part of the program. So everybody loves to talk about what they want to do, how they will do it. Then they make it look like it's a dessert about how they plan to measure the success of what they're doing. And I think that's them betraying the principle of, I think one of the best definitions, by the way, I've loved about data is calling it the single source of truth. It's the sole source of truth. And in a country where we are grasping with resources, fiscal space is tight, we have small money to achieve a lot of things, I think our biggest and best alternative is data. Because it's only data that will tell you who is doing what, who is already where, and where can you identify opportunity for complementarity. So for me, the first biggest problem is that system, that people do not actually take time to institute a structure to measure what they are planning to do. The second bit will be around us as a country, and that's where the systemic part comes in, not thinking through how to simplify the process of data. I think as a country, we first need to agree that data is important. And if we agree data is important, we then need to create a system that make it easy for us to centralize data. And I'll paint a good example. If today I want to have an intervention, I need to collect some data. The source of data in Nigeria is DHIS2, and NHMIS tool is what we use to collect that. But NHMIS tool are not being revised annually. DHIS2, to update a new indicator on DHIS2 is not something that will happen overnight. You need to probably write a letter, you need to convince, you need to do all of those processes. And because of all of this bureaucracy, it then becomes very difficult that if I need to have my program, I need to collect my own data. And the moment I collect my data, it becomes my data and not the government data. And the government have only one job, which is policy, enabling environment, and creating direction for your implementation. And the moment they don't have their own central platform to collect and harmonize your data, what you are then reduced to is to have to count on your own source of data that you are analyzing. You are done with your implementation, you live with that. And for me, that's the systemic part. Then the third bit is the tool. I think as a country, we can do a lot better when we digitalize some system. And that's why I always say data is not a lone child. A system is not just going to say, I want to strengthen the data, maybe from health or from education. There needs to be a ministry that their only job is to think about how data are being collected, aggregated, and processed. Because if in 2026, We still need to use paper tool to collect some data. You need to move those paper tool and move it to this area and all of that. That's one. Two is data are collected at the point of implementation often. And this point of implementation, if you need to collect it with paper, some people need to aggregate it. You already know what will happen with entry error, people misreading what is being typed and all of that. Then when you then need to get it to maybe the first level, maybe at word level, at LG level, and you want to impute it, the question is how many of these people, and that's what I'm speaking about too, how many of these people even have the laptop or the computer or the device to collect all of this data? Now for the few that then have the tool, what is the source of internet that they need to upload the tool to the central database? When this thing gets to the central database, do we have a clear SOP of what are the deadline on when this data need to get to where it's ought to be used? And how do we have like a timeline on where all of this should have been processed and used for decision making? So that's why I said it's a full problem from the system to the tool and to the people. And if we need to make any progress about data in Nigeria, we need to sit down, think through it that way, and ensure that we are addressing it from the basis of, I always use 5 pillars to address how I think we should solve the data. One is who is collecting it. 2 is what are the different levels we are collecting it from. 3 is what's the frequency of the collection, analysis, and use. Fourth thing I like to talk about data is what's the mode of collection. Is it paper-based or is it data? And the last thing I like to talk about data is what are the mandates and policy that guide how it should be used and who is retaining the intellectual property. If as a country we do not think about it across that value chain, I'm sorry, I don't think we are ready to make data use a big thing in Nigeria.
Thank you. Thank you very much, Hafiz. I mean, you've said a lot. And I mean, if I should pick it and bucket it just the way you have done or just the way you have mentioned, it's the people. We're looking at the people, we're looking at the systems, we're looking at the tools. And something that really stood out to me is, in Nigeria, we're already operating in a very constrained fiscal space. And then it's important, it's imperative that data informs a lot of the work that we do so that we're not just doing things as we like, but resources are channeled definitely, and we're able to track and see the outcomes that we eventually want to see in Nigeria. And Afis has really talked about it at a very high level. Let's bring it down a little bit, right? Let's go to the facilities where this data is being collected. For MNCH, it's majorly at the facilities. Let's go there. What are the challenges right there in those facilities that the healthcare workers, who clearly are the people that majorly the people that take or record this data, the challenges that they face there, because it's one of the major points for us. So over to you, Dr. Victory, right? Let's bring it down. Let's bring this down to the ground level, to the facilities where, for MNCH, this is majorly the point where we get our data from. And we're talking about the healthcare workers here. These are majorly the people involved in collecting and reporting this data. What are some of the challenges at that level that we currently experience?
Yeah, thank you very much, people. I think this is a very important question. Hafiz has spoken. Hafiz has partially answered this question, right? There are different angles we can come at the problem from. I think I'll first of all look at the problems with data collection. When we look at data collection, look at capacity. What is the capacity of the healthcare workers to collect data, right? There are lots of, oftentimes there are some capacity building initiatives that happen, a 2-day, 3-day training for some healthcare workers. And is that really enough to train healthcare workers on something so important as data collection within the health system, within the maternal and newborn space, and the health system generally? And which now brings me to another issue. Attrition. Even when healthcare workers are trained on collecting the appropriate data, the right data, on how to enter the data, right, then within that level you're talking about, the frontline healthcare workers, there is a lot of attrition. We have seen this in our work. There's a lot of turnover. And the healthcare workers that you trained last month or 2 months ago may not be the same ones you would meet in the facility today. Is there a structure or a system to transfer the knowledge, or to ensure that the knowledge is continues within that system. So what's the capacity for continuity that we have, for sustainability that we have? Going back to the actual data collection skills, I would want to talk about not just collecting the data, but understanding the data, using the data for decision making at that level. We have a problem with that. With a lot of the time, data collection is seen as a procedural thing. There is maybe a health medical officer of health that said this data must be collected and then it's sent to this layer and then it's sent to this layer, and maybe they feel, okay, if this data is not collected, you'll be sanctioned in this way and sanctioned in that way. But is there actual understanding of why that data is important? Because that is going to inform whether the person falsifies data or not. That is going to inform whether the person actually pays attention to entering data. We can be truthful with ourselves. There's always place for human error, especially when it's a human being that is sitting down to enter data, and especially the way we do it, where it's first of all in paper format. Maybe the frontline health worker is entering data per patient that comes, and then we transfer it to a digital tool, for example. And the process of that transfer alone, there is room for a lot of error. Or if everything is being collected from 30 facilities, 40 facilities at the Apex facility, there is room for error. Are the healthcare workers cognizant of how important that data is to be careful enough to reduce error? So just to summarize, and so that I don't take a lot of time, the several issues are, first of all, capacity issue. What is the capacity of our healthcare workers to recognize and to properly collect data, and to do this without errors? The second thing is attrition. Even when we train and we do everything to build the capacity of healthcare workers, there's often a very high turnover rate. And the third thing is about data use at the level of, at the health facility level, as well as at, let's say, the local government level. There's often some decisions that they need to make utilizing data. Are they able to use it? What is the process of transferring that raw data into something that can be used for decision making? Right. Those are some of the problems I have seen, and I didn't speak about this because Afiz already talked about it. But the tools, right? We use a lot of paper tools, and then later it's converted to digital tools. What is the capacity of healthcare workers to use digital tools from scratch? What's the capacity of our health systems to start with digital tools, which will minimize a lot of error, but can it be used? Those are some of the problems I can see at that frontline level.
Yeah, thank you very much, Dr. Victory. I mean, at that level, right, the data is not just useful at the top. So we're not trying to move the data to the top so that the top can use it for decision making. Right there in the facility, data is important. So they don't think that we're collecting the data for the people that will use it. They themselves need that data to inform a lot of the decisions that need to be made, right? I'm just thinking about it. For example, let's even look at it from the commodities aspect. A lot of the things that we're trying to stop now, we stock out of commodities, right? So we need drips to ensure that we're able to monitor blood loss in women, or we need the emotive bundle to administer to either prevent or manage postpartum hemorrhage. But if this is not properly tracked, it is at that point that data is needed for the facility to know when to restock, the potential for stock out, at what point are we going to experience stock out, so we can restock, and at no point will any woman lose her life because the necessary commodities were not available at the facility. So I mean that's already what I'm thinking about from what you have said, right? And then Dr. Victory has already moved into something else, the quality of the data. Because we're going to be using it for decision making, the quality of that data is important. And that's where she said, do they even know the importance of what they're actually doing? So Hafiz, I'd like you to touch a bit more on data quality in Nigeria. What is this really?
Yeah, thank you very much, Billy. And that's a very brilliant point from Dr. Victory. I think one last thing I would like to add to what Dr. Victory mentioned around the problem at the health facility level is also us respecting the workload.
Completely
Yeah.
You
agree.
have an healthcare
Yeah.
worker at the health facility level who
Yeah.
need to attend to the patient. Same person need to record. Same person need to call for vaccine or for drips or for anything. You already know that the workload is not sustainable and there will be break in it.
Completely.
So if we need to actually strengthen our health system, which is what we said at ACE, that's what we stand for. We do not just strengthen one unit, we have to strengthen the system. But to answer the question, when you say quality of data, I like to describe it in 4 ways. I would say number 1 is completeness. Number 2 is correctness. Number 3 is congruency. And number 4 is consistency. So for you to say you are talking about quality data, it has to be complete. Because it's when data is complete that it's easier for you to interrogate whether it's right or wrong. If I'm collecting the data of, you use an example of drip, which I will use and say, how many drip do we have at this health facility? And there is a table where you say, drip, this is the number, this is the drip, this is the number you use, and you don't have the brand of drip. The day we are complaining that a particular brand of drip that we have at this facility is always tearing when we are trying to use it on the delivery bed, it's hard for you to take that decision because you are not even collecting the drip based on the brand and the manufacturer. So that's what I say about the completeness of data. The one everybody tries to make a lot of noise about is always the correctness, which is you want to enter 1, you enter 2. But trust me, that's one of the smallest problem about data. Because when the data is not even complete, correctness is already faulted. Congruency is data must speak to themselves. I've analyzed data in the past that you see something like a woman, in this household you have a woman, then you have 10 under 5. And you know it's not possible. Even if the woman give birth every year, you cannot have 10 under 5. And that's the congruency that we try to, that's it exactly, maybe quadruplets, right? So, and when you don't see that congruency, you can say this data is not speaking. And the last one is consistency. Data must always be consistent. I always say the first thing that I use to sieve a good data from a bad data is always when I look at data and it's not showing me what I'm comparing it with and what I'm supposed to achieve. So the data you are reporting to me must always be sandwiched by your baseline and your target. Because that is what gives me the ability to see how consistent you are doing or how inconsistent you are doing. So if I'm describing data quality, I always like to describe from those 4 lenses of completeness, correctness, congruency, and consistency.
Thank you very much, Hafiz. I've taken home my own lenses. I hope you have. So please, as the conversation is ongoing, feel free to share. Please drop a comment. Right, this is something that is real. It's a reality in Nigeria, and we need to chart the way forward. Right, share, leave your comments. Let's continue the discourse. Right, so we'll continue to get right into it, Dr. Victory. I'd like to now ask you. Data is being collected. Hafiz has gone ahead to mention some of the quality issues when it comes to data. Some key things to take a look at. Now in Nigeria, we're collecting the data, all these key things, this and that and that. Do we have a culture of data use in Nigeria? The data that we're collecting every day, is it really informing anything? Or are people just going ahead to do anything that they want to do?
Yeah, so that is a very important question. And if you notice, I started to talk about it when you asked me the first question. But this is even something that is our reality, right? At least it's something we struggle with every day in terms of coordinating different angles of things. And the fact that when data is collected, is it being used? So the importance of data, one of the things I said was the use. Data just being collected for collection's sake, that doesn't do anything for anybody. There is no need for it. So I'm going to look at this from first angle is, do we have the capacity to use the data that we collect? What I mean is a lot of organizations, implementing partners, and the rest, we collect data and then analyze it on the go. Maybe Afis talked about something, consistency. a lot of organizations or a lot of our health system, a lot of times we even collect consistent data sometimes, but it's maybe one day someone wakes up to say, oh, what's happening here? And then we immediately analyze that data right there and then. But then there is going to be the next 10 months, nobody's looking at what's happening. And when you've used what you analyzed 10 months ago, it's something has happened within 10 months. So do we have dashboards that continuously update themselves? Do we have systems or processes that continuously look at the data? No, we don't. And this is very important because that's what helps you make decisions. Real-time data monitoring, real-time looking at your key indicators. A lot of the times, a lot of indicators may be collected, but you can't always monitor all the indicators. But Afiz mentioned something about looking at where you're coming from, your baseline, looking at where you want to go, and looking at where you are now. So you had key targets. You had in the next 5 years, Nigeria wants to have, for example, 25% or 30% MCR, 27% MCPR, right? Where are we now? In the next 2 years, where are we? As in, let's say we are in 2 years from now. Now, where are we now? Right? Where are we supposed to go to? How far are we? What are the things that we need to do to get there? So that's one of the things with using data for decision making. It has to be real time. It has to be something that can be monitored on the go and not something that is analyzed per each time a person suddenly wakes up and feels the urge to say, where is the data? Right? There must be people monitoring the data. And that's why at ACE we have a lot of back end. During all our programs and for all our interventions, we have a back end team
the control room
that continuously monitors the data. Say, where are we at? Are we there? Are we not there? If you're not doing this, you will lose track.
Absolutely.
And another thing I would want to talk about is in my first discussion, I mentioned something around performance data. One thing I've noticed within our development space, now not just MSCH, not just health sector, within the development space is that we collect a lot of performance data. To say, let's say Afiz is handling a project and the project is about reducing maternal mortality. That is a goal. That's a long-term goal, I agree. And there are a lot of things in the process, right? Let's say your angle is producing PPH commodities. And Afiz's entire focus, and the only thing he focuses on is how are my commodities moving? How many commodities have I sent in? How many, just those commodities. Not how are the people using the commodities? Who are the people using the commodities? Is it actually changing anything? Do those people know how to use the commodities? No. But what Afiz focuses on is now just how many commodities have come in. I've sent in 10, yay me. I've sent in 20, whoa, I'm doing amazing, and that's it. And a lot of the time, just one organization is not going to be able to call. It's like each person has their piece, right, of the puzzle, and one organization is not going to be able to collect all the data, and that is why the importance of that centralization you talked about. To say, okay, if Afiz brought in 200 commodities, Victory is supposed to train the healthcare workers on using these commodities. What did Victory do? Okay, Biobele is supposed to assess how the healthcare workers are using these commodities as they've been trained to assess for the impact or for the outcome that we're looking at. So the importance of data for decision making it's very important, because by the time everybody's collecting just performance data, everybody's just looking at performance data, we will be able to say, I'm doing a good job. But just like what is happening in Nigeria now, you will not be seeing any change. You know, as we all know, our maternal indices worsened from the last NDHS, like the 2023-2024 NDHS. We had worse maternal indices compared to 2018. Meanwhile, we have been doing a lot of work. The performance has been great. People have said, oh, I have moved so much commodities. People have said, oh, I have trained 100,000, 200,000 staff.
Yeah.
But what is
the
that
intersection?
impact on the outcome?
At the end of the day.
So
Absolutely.
it helps to say, okay, everything that we are doing is not working. We need it to use to make decisions. Yeah.
Someone I often listen to always calls data program intelligence. And that's really what it is. It is the intelligence in the work that we do.
Absolutely.
Because every other thing outside of data, you're just moving blindly. You're just doing things for the sake of it. We are not filling records to tick boxes
Yes.
of grants
Yes.
or to be able to invoice these things are making it's actually the lives of people. It's not
Yes.
just
Yeah.
statistics.
It's not number.
It's not number. It's
Yeah.
people's lives that are being touched, right?
Absolutely.
So thank you very much, Dr. Victory. So let's. I mean, we've talked about it, and we can continue. The issues are a lot, right? But what's the way forward? It's not just about mentioning the issues, but also curating solutions to these issues. A lot of work is already being done. So Hafiz, today, if we could focus on solving the issue, right? What 3 things should we prioritize as a nation right now to fix our data systems?
Yeah, thanks, Biobele. And that's a very brilliant definition you give to how you like to refer to data, which is the program intelligence. I like to discuss data as, I call data experience. And I like to say that experience is like the comb life gives you when you've gone bald. Meaning, the comb is only coming after you don't have hair in your head again. And that's why it's an experience. So data is as useless as it is when it's not being used for decision making. And that's why I enjoy the bit around how Dr. Victory has emphasized on the need for us to ensure that data is moved beyond just numbers, but we are using it to take decision and looking at the intersection.
Yeah.
If there's one thing we need to do as a country, I think we need to declare it as like an emergency. And I will take it as what I feel we need to do across all of the level. As a donor, I look for a world where your part of the biggest thing that will inform if your grant will be approved is your clear description of how your data is integrated into what the country is doing, who is collecting your data, how it will be collected, the sustainability plan for that data, and all of the key decisions the data will be used for. And finally, the implication of those data for all of the stakeholders you'll be working with. If you're not going to give me that output, I will not approve your investment. I think for me, that's what I would advise to a donor. For government, for me, is no investment fly, whether national or state government, except you have clearly demonstrated your data archival system, your data collection, analysis, archival, and dissemination system, how all of those fit into the existing government structure. If you are not clearly defining that, you will not move an inch with your implementation. That's what I'll do from a government lens. From an implementing partner lens, I will recommend and push for no program should be implemented without a real-time data control room, 1. 2, you have to be telling me a lot about how the data that you want to generate from your work as an implementing partner, I need to see clear roadmap of where all of this will be going to and how it affects all of the partners that you are working with in this place. I think that's one big thing I would say for an implementing partner. The second thing for an implementing partner, if I will be giving an advice, is as you work, like I said during my introductory statement, I don't want us to be treating data as an add-on, but it has to be the heart and soul of the program that we are implementing. Because how far, how successful, and how well that project will be implemented will be dependent on the quality of data that you collected, and not just collection, how you move it into decision making. Finally, if there is then a broad feedback I'll give to everyone about data, would be that data should be treated as the only source of truth, and nobody owe you trusting anything you are coming out with without clear data that is showing the progress, the limitation, as well as the success and the next plan that you want to do on your project. So if everyone believes that my investment is as useless as it is, except it tick all of those boxes of project data and system sustainability to be discarded. If we look at everything from that lens, I feel as a country will make a very quick movement in data and not just what we currently do.
Yeah, thank you very much, Hafiz. I mean, looking at it from that lens, the donors, the government, and then the IP levels, there's the role everybody has to play. You've said that individually, and I already see the interconnectedness or the potential for collaboration. So to end this conversation, right, we will continue, but to end this session of this conversation, touch on the role of collaboration amongst all of these parties, down even to the health facility level that we discussed.
Yeah, thank you so much. So collaboration for me would be, the data does not belong to the government, and you'll be shocked to hear that. It's not belonging to the donor and the implementing partner. The data belong to the people. So any work you are doing, any data you are generating that is not carrying along the people that you are trying to save their life is as useless as anything. So if you are talking about collaboration, I will speak more from the collaboration of who are the most important people when you are collecting any data. It's the community where you are working and where you are looking to achieve a change. And that's why one of the biggest clauses they will give you when you are trying to get an ethical approval is always, you must guarantee that the findings from this study will be disseminated first to the beneficiary, because you use them to collect all of the data you used to do your work. I think that's one. Then on the partner side, I think collaboration needs to be so strong that we all understand that we are working for the same cause, and I will not move an inch except I've objectively checked that the scope of implementation I'm trying to do, I've mapped out everyone that has done something similar and everyone that is doing something complementary, and I'm ensuring that my program is designed to suit what they are doing, and all of the data I'm collecting every day is fitting into one big goal that we want to use to achieve our results. From the donor lens, I love that through some of the support we provide, donors are now also coming together and ensuring that they are speaking with one voice. They are ensuring that all of the implementing partners, irrespective of who is funding what, at the end of the day, we are responsible for only one person, the people, the lives we want to save, the mother, the children, the vulnerable group.
Yeah.
And that collaboration needs to happen at that big stage, because we cannot deny the fact that he who pays the piper dictates the tune. If they make it an action plan and a call to action that no investment, no spending, no approval will go except we have seen the interoperability of the data that will be generated by all of the players in the place, we will not let this move. At that point, everyone will come together and see the need for them to bring their work together. So nobody is looking to take a shine and say, I did it. Rather, everyone is seeing the work as we are all working for the people, for the vulnerable group we claim to want to save, and except our data is going to be useful for them at the end of the day, it is as useless as us not doing anything. Finally, about the collaboration will be that I have seen a lot of people do a lot of brilliant data collection, excellent data analysis, complete data congruency and all of that. But when they finalize their interpretation, it is not socialized to a stage that it can be comprehended by the people that need it for decision making. And that's where the collaboration comes in. When you bring in every party into the room, from your planning phase to your implementation phase to the data collection, analysis, translation, and dissemination, one thing that you are very sure of getting is everyone will provide their input to ensure that the data do not just have like highfalutin information on the big shelf, but something that everyone can come to at the end of the day to use for decision making. And that's where they say collaboration is the only thing that guarantees sustainability. So I think I'll pause there.
Yeah.
Thank you so much, boss. Thank you so much, Dr. Victory. This has been a very insightful session, right? And just to re-echo, just like Hafiz has been saying, everything we do is for the people. In this case, it's for the women, it's for the children, the babies that we're ensuring do not die, the lives that we're saving, the families that we're keeping intact, right? We echo it over and over again. The work that is done is beyond numbers, statistics, targets. It's real life people that we're impacting. So when you have, with this understanding, everything we do is important, and every documentation is just as important, informing a lot of the work that we do. So thank you very much for joining us today. This has been very exciting. Thank you so much, Hafiz, for being a part of this conversation and for lending your voice and your wisdom as well. Thank you very much, Dr. Victory, for the experience that you've shared with us. And thank you to our viewers. Thanks for watching. Up until this point, please like, drop a comment, subscribe, and share to your friends, colleagues. Have conversations, right?
Yeah.
Make use of, I don't know, like we mentioned, build your data systems and ensure that every work that we do, every decision that is made is backed and informed by data. And I'm pretty sure if we get this right, we're right on our way to achieving the targets that we aim to achieve right here in Nigeria. And we will see you next time. Bye-bye.
Yeah.
Bye.
Bye, everyone. Thank you.
Thank
And thanks
you.
for joining the conversation.